We turn out fellows that are really strong clinically. One of the things that we hold dear to this program is the ability to kind of craft your own pathway to try to accomplish the goals that you want to accomplish.
We're looking for fellows who are really enthusiastic coming in. We have a lot of resources here, and we're basically looking for fellows who can sort of utilize them to sort of make the best use of this 2 years.
There's a lot of clinical work to be done. We are an outpatient specialty. There's a lot to be learned in rheumatology. These diseases are multi-system diseases.
We do have 3 different clinical sites. We have our clinics here at Vanderbilt, over at Nashville General, which is a county hospital, as well as the Veterans Hospital.
The fact that Vanderbilt is the only academic medical center in town means that we see a whole lot of diversity of cases, everything from really sick ICU patients to bread and butter rheumatology patients. And having those 3 different work environments really helps with that variety.
We have a lot of great clinical resources. We also have amazing research opportunities here.
In the Division of Rheumatology and Immunology, we have world leaders in research in pharmacogenetics, epigenetics, disease outcomes, quality care for patients. And so being able to do your fellowship here, you really have a broad spectrum of individuals and faculty that you could interact with.
The division itself has 26 faculty, both fundamental scientists, translational scientists, near peers who are just beginning their research career, as well as established investigators. We also have very strong support from the Department of Medicine and the institution, who can provide exceptional collaborators, both clinical collaborators as well as research collaborators.
Now, if a fellow would choose to become a physician scientist, they may want to add a 3rd year to their fellowship. And this can be facilitated through a lot of our T32 training programs. And this really gives them the protected time to be able to focus on research and maybe pursue a question in more depth than they normally would just in a regular fellowship.
I took an extra year on a T32 grant and did a full-time research year in addition to doing the classes for the master's. Doing that program allowed me to get more training in biostats, epidemiology, clinical trial design, and really kind of give me the tools that I need to then try to develop new cohorts or prospective studies of my own.
Fellows have plenty of opportunities to do research because of all the resources that we have here. And those include, for example, the synthetic derivative, which are the identified electronic health records. And we have data on more than 3 million people right now.
The technology that's available at Vanderbilt is, I would argue, unparalleled. So when I started my own lab, we developed a translational program where we're actually looking at these antigen-specific B lymphocytes in individuals who are at very high risk for ultimately developing type 1 diabetes. They don't yet have diabetes, but we know from various biomarkers that they will almost certainly go on to develop symptomatic disease. So that is one program that we've developed. We're also, of course, interested in looking at some rheumatologic diseases.
One of the real strengths at Vanderbilt is the multidisciplinary training focus. So I'm one example of that for being rheumatology and pulm critical care. In that capacity, I run something called the MYSTIC cohort, which is the Myositis and Scleroderma Treatment Initiative Center cohort. So one of the benefits of having a strong relationship between pulmonary critical care as well as rheumatology, we actually have rheumatologists and pulmonologists seeing patients side by side, and it's super helpful. These are people who are willing to sit down with you and teach you and really give you that one-on-one attention that you need as a learner to really excel managing very complicated patients across multiple disciplines.
There's a lot to be learned in rheumatology. These diseases are multi-system diseases, and so I think it's just really important for fellows to see a lot of different types of cases.
And I think having that exposure and having that, really tight-knit group of expertise that's available here is pretty unique.
It is just a very collaborative environment, a very welcoming environment. And one of the things that I have found most impressive is the level of mentorship at all levels of training and early career.
Fellowship at Vanderbilt would really prepare you for any career.
The overall goal of the Division of Rheumatology, as relates to our fellowship training program, is to make sure that every fellow has exactly the opportunity that they need to develop the kind of career that they want to have.